What's up, guys? Welcome to the Stancil Strength Podcast. First episode. If you didn't know that already, you'll probably realize that not too long into it. But we're just trying to get this information out to you guys. I don't have the microphone yet. As you can see, we're not in a podcast studio. We have the dogs on here.
We're on the couch.
We're on the couch.
Very raw.
I want this to be raw, unedited, just kind of a conversation. And just trying to start this podcast, right? That was the goal, was to start the podcast and start getting this information out to you guys. So a little introduction. I'm Jess Stancil, IFBB Pro, men's physique bodybuilder. I'm an online fitness coach. I've started working with a few people more in the functional health kind of space, but I have several years experience training people in person. Now work more online with people. I basically just help people get results with their health or their fitness. And I now help a few other fitness coaches with, getting results for their clients or looking more into more complex things like reading labs, things like that. And I still train a few people here and there, some of my online clients that are local. I've been a bodybuilder and been into health and into fitness for a long time, and just passionate about this stuff and want to start not only reaching more people to help, but just putting more free information out there. And we have a few questions and kind of topic ideas from an Instagram poll that we're going to go off of today, address some of those things, and then just kind of go off of the cuff. The best way to start this series, whatever you want to call it, out would be with my wife, Brittany Stancil, recently graduated, new board certified nurse practitioner. You want to say a little bit about yourself?
So hello, I am Brittany Stancil. I'm Jess's wife. And yes, I just recently graduated nurse practitioner school and recently passed my boards. Yay. I'm taking a job in family medicine. So I will be taking care of populations from newborn to geriatrics. So I'm going to be seeing it all, and I'm very excited. I'm very comfortable and confident with, Western medications, but I really, truly have a passion getting to root causes, treating people in a holistic, functional way. So it's perfect that we both have this love and passion for functional medicine and wanting to help people in that aspect, as well as fitness. We both have worked out our whole lives, and it's really important to us. So
yeah,
I'm excited.
So very excited to start this off. So that should kind of give you an idea of just the information that we want to get out to you guys. I approach things more from the functional, the holistic side of, lifestyle, nutrition, and training. And then Brittany knows, the conventional medicine side. And we want to give you guys both perspectives of that with the topics that we're going to be bringing up on not only this podcast, but, future episodes to come, to show you guys that there are some crossovers and some similarities to conventional Western medicine and more holistic lifestyle focus as far as health and fitness. So we have a few topics that came from the Instagram poll to give us a couple of ideas. One of those that was interesting that I can kind of branch off into some subtopics of that will encompass more of these questions that we got was topic around cycle syncing your workouts, and that's not for tailoring your workouts to what cycle you're using, but we're talking for females that are training seriously. The question is basically, should you train differently or tailor your program differently to your monthly cycle and what time of the month it is? I want to see first what Brittany has to say about that and her perspective.
From a medical or personal perspective?
Let's go personal.
Well, personally, I, I don't really, I do factor my cycle into account. It depends on how I feel. Now, if it's like a day where I'm like heavy and fatigued and bloated, I listen to my body. I will take the day. I will go for the walk instead of lifting the weights. Um, but usually, other than that, I stick to my normal training and just keep my usual grind unless I'm just really not feeling it. And I've had heavy cycles with the Paragard IUD. Unfortunately, 30% of women have increased menstrual bleeding with those IUDs, and I'm one of them. So every month it was like a dread of 2 days worth of just really heavy bleeding. So I would take the day off from the gym. So it's just really important to listen to your body. It's very important.
It's individual, but it's
Sure.
for you. It's more intuitive too. It's not a part of your program where you would say like, this is this time of the month, so I've got to do this workout instead of this workout. You're listening to your body.
Yeah.
So I have the same kind of perspective on this. Other than I don't have a monthly cycle, but I coach a lot of females, and if the question is like, should you tailor your training to your cycle? For me personally, like with my clients, the short answer is no. I think it's a valid point, and I think a good place to start is just understanding what's going on there and being intuitive too, like Brittany said. The reason that I don't specifically like change a client's training or program totally whatever based off of where they're at in their monthly cycle is that I like to look at the whole picture. So I do a check-in with my clients each week, and we address how everything is going and how you're feeling and recovering from everything as a whole. So we're going over, like, my mentor taught me the SHREDS biofeedback, which is going to be your sleep, hunger, recovery, energy, digestion, and stress. All of those things obviously play a role into how you're recovering and how you need to train and eat. So I look at all of that biofeedback. Where am I going with this? I like to see, if somebody is feeling under recovered or overtrained for any reason, then that's when we say like we can do a deload week or we just take an extra rest day. The first thing we're going to look at is like, did you do all of the workouts that were prescribed, or did you like do too much? Because if you're overdoing it, if I have 5 workouts on your plan and you go in and you do 8 of the workouts in the week, and under eat and do more cardio than we've had you do, then that's not following your plan because you're not recovering enough. So we're going to look at that. We'll look at, obviously, sleep is like always a big factor. That's always important. But if you're feeling worn down, under recovered, we want to really emphasize the sleep. Supplements, which we'll get into later in this podcast, play a role. Hydration, electrolytes, your calories. Are the calories that I'm prescribing you enough? Are you hitting all of those calories? So we'll look at all of those things first, and then I take a look at the big picture and then say, your monthly cycle, if you're on your period or something and you're feeling up, that might just be one factor that can make you just require a little more recovery. But I don't change your program for that specifically, because I'm looking at any reason that your recovery might be down. And I don't want somebody to like over recover, which would basically be like almost kind of making excuses to say like, oh, I'm it's this time of the month for me, or I missed an hour of sleep, or I had a stressful day, or hard workout yesterday, so I'm gonna take it easy for a couple days. And if you do that every day, like when it's not really necessary, before you know it, like you've gone 2 weeks without training, and all you've done is walked and done some yoga, and you're recovered. That's great, but you haven't worked out. You haven't trained in a way that's conducive to your goals. So a good way to put this, another thing that I got from my mentor, Sam Miller, who I have to give him credit for this concept. I specialized in functional nutrition, metabolism specialization through his program. And there's this idea that we talk about of your drains and your charges. So a drain is going to be anything that takes energy away from you, whether that's like a really hard workout, a poor night of sleep, a poor day of eating, alcohol, could be a stressful event or a long day at work, or just like negative ass people, right? Something that, drains you. And then a charge is going to be the opposite of that, which could be a good night's sleep. Good people, your dogs, our dogs are always like, they're going to be in these podcasts more, but they're recharging us as we're talking.
A good workout.
If you're watching this on the video, they're gonna be a good workout. Can be a charge. There are gonna be certain things like a workout that could be a drain or a charge, right? That's gonna depend on how the whole picture is looking. If you're underslept, underfed, I don't know if that's the right way to word that, but you know what I mean?
Malnourished.
Yeah, malnourished, dehydrated, overtrained, under-recovered, then working out really hard will get to be too much.
In a state of fight or flight, which
Yeah.
will, increase your cortisol, which increases inflammation in the body, and that's going to drain you, and that's going to affect so many different aspects of your training and life.
If it's too much,
Yeah.
right? From my perspective, I'm a bodybuilder, so usually the way I train is like hard, and I think it's funny when people say like I just love how like working out gives me so much energy. I'm like, I feel like, can we cuss on this podcast?
Yeah.
I feel like just fucking beat after a hard leg workout. So that's usually going to be a drain for me. But then recovery, my charges have got to balance that. So if you look at all those things, also like caffeine intake, right? Too much of that, it's borrowing energy, but in the long run, it's draining you. It's a balancing act, right? And sometimes those workouts do have to be drains depending on what your goals are. Sometimes you do have to be kind of overtrained. For example, like if you're one of my clients who's in contest prep, we're going hard for like a bodybuilding show, we're grinding in that last couple weeks where calories have to be low to lose that body fat to meet a certain standard. Training's got to be really hard to keep that muscle, your cardio's up. You're gonna be tired, you're gonna have to be in a state where like your drains are gonna be a little higher than your charges, because if we have that strict goal, for example, competition, you can't just eat more or take more time off if there's a requirement to hit that goal. So sometimes we do have to have more drains than charge. In that case, we just want to balance recovery the best way that we can. And then to talk about the competitor a little more, like if we're looking at that person and they're feeling overtrained, worn down, underfed, etc., then if you're training for bodybuilding, it's all about how you look. So we really are just going to look at how you're looking. If I have that kind of client check in and say like, hey man, I'm just feeling like shit, which is normal for 1 or 2 weeks out from a show, food is low, and they say like, I'm trying in the gym, I'm not being a baby, like I'm really giving it my all, and like performance is not there. I'm just really worn down. Then we're gonna look at like, the goal is to look a certain way. That's all it is for that particular client. It's individual, but for that client, it's how you look. So is the fatigue showing in your physique? And then if you are feeling horrible and performance is a little low, but you're looking better, then like, we're going to keep feeling bad and looking better, you know?
Would you get lab work on that person?
I would, at some point in that process, I like most of my clients and myself will get lab work at least before starting a program or starting a new phase, like a hard cut, trying to lose that body fat or bring your best to a show. When it comes to that close, it's just like, what's the goal? How are we looking? And then on the flip side of what I said, if that person's feeling worn down and their physique is like declining or progress is stalled and it's not getting better, that's when that person would need a little more recovery. And that might be the trick, because even in that situation where we know we have to be drained, there's still like the importance of recovery, where we can't just like keep pushing harder to get a better result, but that person still has to push pretty hard. A lifestyle client, somebody that like doesn't have that super set hard goal, they won't have to make that many sacrifices, like eat the food, take the rest day, you know, but it's individual.
I was just curious because personally, I used to do CrossFit, which listening to you talk about drains and charges, that is a draining workout. Whereas now I train more for longevity, which is weightlifting and walking, for instance. So they're actually charges for me, and I don't train like for competitions or anything like that. So I'm not like going to failure, you know, exhausting myself. Like I said, I just go for longevity, and they're charges for me. So great for me. However, back to where I was going with this. When I did CrossFit, I was very not knowledgeable about anything. That's where I have all my injuries from. I was drinking a lot of water, working out super hard. I was finding myself to be very lightheaded, dizzy, fatigued, drained, like just not feeling myself. So what do? I go to my doctor, get labs drawn. Guess what? My sodium was like 129. So I didn't know.
That's low, right?
Yeah. So it's on the lower spectrum. It's not terrible, like where you're going to get confused because your sodium is so low. But I will say,
for
like,
an athlete,
it definitely like messed with my brain, because I was having trouble like thinking. Like it was just, my brain wasn't as sharp as it typically would be. Long story short, I was drinking too much water and not enough salt, because I feel like a lot of you females probably agree with me on this, but like I feel like I hold on to fluid very easily. So salt follows fluid. So I don't put salt on anything. Well, I didn't. And then I added salt back into my diet, and all of a sudden I felt better. I was actually staying hydrated with all the water I was drinking, and even my mental focus and clarity came back. So it's just something as little as a salt fix that could be your problem, which is why I was asking about labs.
Absolutely. Labs is a great topic. So if we have addressed all of those other things, like your water, your salt,
just gives
you
peace of mind.
You're not overtraining, you're getting enough sleep, doing all of those things right, and still not right, then a next step is usually like checking hormones, specifically looking at like thyroid, possibly that's your metabolism, or your testosterone,
estrogen, progesterone.
Yeah, the whole picture. Maybe like your blood count.
On that.
Maybe your blood count. That's a topic for another day. I think we could do a whole podcast on hormones and labs, and we're open to any questions on that kind of stuff. But that's just another good example of like individuality. Like for her in that situation with the low sodium, that didn't work for her because she was killing it doing the CrossFit stuff and drinking a lot of water. Somebody else might have, different nutritional requirements, different drains, different charges, different just chemistry overall. Like they don't need that amount of sodium, but as an athlete, you do. So
So I have a question.
Everybody's individual. Yes.
With the drains, and this is going to be more towards your prep clients. I'm curious, like obviously when you get to a certain point in your prep for a show towards the end, I feel like you're in a constant state of drain. Do you recommend, like what time of day do you recommend that they do their workouts, or like the hardest thing that they have to do during the day? Like,
Yeah. Gonna depend on the person. Again,
That's a lot in
I
it.
hate to have to give that answer because everybody wants to know just like what's the best thing for me, but it is individual. The best guideline I could give around that is I personally like working out in the morning, either like first thing in the morning
Same.
when I'm on prep, or not too far into the day, maybe after one meal.
Yeah.
When you have some energy, but you would want to find that time when you have the most energy. And depending on your goals, again, like if you are hardcore into prep and you don't have a lot of energy to spare for the day, your reserve is going to be a lot less. And especially like if you're a high level competitor, or you're trying to be, or you're a pro, that prep and that training is super important to you. So like the time of the day that you have the most energy, if that's the morning or whenever, that's when you would want to work out. Now, if you're not that serious into it, you could probably save your more productive work for when you're feeling good and just get that workout in sometime, because you don't want the workout to drain your energy for the rest of the day if that's the way that your training for your specific goals makes you feel. But if you're on prep, like a lot of times just gotta say, this is like my hour window between like the food I've had and when I feel the best to work out. I've got to try to push through this workout at this time and feel like shit the rest of the day, because that's the focus if that's the goal. But if you don't have to make that kind of sacrifice, I would say I still think morning workouts are a little more ideal for most people than night workouts, because you're increasing your stress hormones, your cortisol, which are naturally gonna wanna be higher in the morning. Cortisol is not always a bad thing. It's what gets you going. It's what wakes you up in the day, and what gets, sugar into your blood for fuel. But later in the day, spiking that is gonna throw off your circadian rhythm and your sleep and your recovery. So that's another way that a workout, could be a charge or could be a drain.
Yeah. I like to train first thing in the morning, fasted, gets me charged for the day. But I do have friends that they're like, no way, you're crazy. I can't work out first thing in the morning. I like to have meals throughout the day. I feel like I get energy from that. So it's just individualized. It's based on your personal preference, and if you feel better at 8 o'clock at night instead of 5 a.m. in the morning, great. As long as you're getting your workouts in and you feel good, that's what matters.
Yeah.
So
it is all
right,
very individual,
Go ahead.
and that's why we talk about like looking at the whole picture, because it's specific, like everything with your training, your nutrition, your supplements, your recovery should be specific to you. But it's not just specific like to this like blueprint of, this is you, this is what you have to do all the time. It's also specific to your lifestyle on any given day. Your metabolism is not this like set thing, like, all right, you're born, here you go. You've got a slow metabolism or you got a fast metabolism, and this is like your body's chemistry. Like these things can change. So that's why I look at the whole picture with people, the training, nutrition, shreds, biofeedback, and take into account your individual differences and like how everything's going on a week-to-week basis, a daily basis, right? Because every day can be different. When it comes to individuality and nutrition, I like to think of it this way. So people have always asked me, even like before I was an online coach, people would ask me, even small girls would ask me like, what is your meal plan to get cut? Or what do you eat to get shredded? Or just a total stranger would be like, hey man, I want to get shredded. Like, can you send me a meal plan for that? Without like further context or anything. So think of it like this, like if you were to go into the gas station and go in and ask somebody like, hey man, like how much gas should I put in my car? Well, you drive a lot, right? Like you've been driving. How much gas did you put in your car today? Like, how much gas do you already have in your car? What kind of car do you have?
Do you need premium?
Yeah. Where are
Regular?
where are you going?
Diesel?
How far are you trying to go? What kind of driver are you? Your body's a lot more complex and adaptive to, and variable on a daily basis than your car is. So there is context to it, and we try to make some general recommendations around nutrition, training, supplements, recovery. That are good guidelines for most people, but intuition is a big part of it. Just kind of learning your body and just really looking at these things. So that's the way I approach it with a client, is like I get as much information as I can from the start. Before we start doing anything, I'll usually have a whole intake process and then have you start logging your food before I set you up with anything. Sometimes do some lab work to see what all your hormones and blood counts are looking like. And then we still address everything on like a weekly basis and just see, because everyone is very different. I think that leads us into the question of supplements. We wanted to talk about, we're going to narrow it down to top 3 supplements, and I think you had a lot of insight on that, some supplements that you like and like reasons behind that.
Man, I could really talk a lot on over-the-counter vitamins and supplements. Trick question.
Like a cabinet's full of them.
Let's see if you get this. What is the one vitamin? There's only one vitamin that we as humans make.
Vitamin D.
Oh, look at you. How'd you know that?
I know a thing or two. I know a thing or two.
That's right. Okay. Well, that's one of my top
She
picks.
does teach me a lot.
That's one of my top picks. And my top 3, I have more
Top
than
3.
3, but the top 3 for most people, not like dialysis patients or kidney disease individual, for example, but vitamin D is one, zinc and magnesium are my top 3 picks. Awesome. If I had to choose. They all kind of go hand in hand. Magnesium is my favorite of the 3. I could do a whole podcast on magnesium has over 300 biochemical functions in the body. Some of those include it regulates neurotransmitters in the brain, such as GABA and serotonin, which affects your mood, muscle relaxation, and contraction. So magnesium is known for relaxation. So it has a lot of cardiovascular benefits. It helps with hypertension. You think, your heart is a muscle. So what does magnesium do? It relaxes the heart. It relaxes blood vessels, dilates, so which will, in return, decrease your blood pressure, decrease your heart rate. People say, I've been having palpitations. Try magnesium. There's also multiple forms of magnesium, so that's where people mess up too. For an example, magnesium oxide is has very low bioavailability, and it doesn't absorb as well. It's used for migraines and headaches. If you do take that medication, for it to work, you would have to have a prescriptive grade that's higher to help with the absorption. But my favorite is magnesium glycinate, and that's what we take every night. It helps with sleep. It helps regulate, your body's sleep-wake cycle. It helps with insomnia. Like I said, it helps with the neurotransmitters with GABA and serotonin, which will decrease anxiety, which will relax you to be able to go to sleep at night. So that one is my favorite. Mag citrate is used for individuals who have constipation. I know I have a lot of patients that have hypothyroidism or just chronic constipation. So I would typically recommend mag citrate for that. Once again, relaxes your gut. So you're able to pass stool. It pulls water to your gut, and it just works in your gut more than the other forms of magnesium. The last magnesium I would talk about is the mag threonate.
Threonate.
Which I know you like that.
Yeah.
That is really good for mental clarity and focus and performance. That magnesium, it has a sugar molecule that helps cross the blood-brain barrier. So it pulls more magnesium into the brain. So that is really good if you are, having trouble with focus, attention, and it's also been proven in some studies to help decrease risk of neurodegenerative disorders such as Alzheimer's, dementia type things. So magnesium is great. Celtic salt has like 3 forms of magnesium: nuts, seeds, green leafy vegetables. But yeah, like I said, many people aren't getting it from their diet. And even if they are, food just isn't the same as it used to be. And there's a lot of things that hinder us absorbing and keeping magnesium in our body, such as caffeine, alcohol, people that take medication for GERD and heartburn, like PPI therapy, those medications, those drugs help decrease acid in the body, but we do need some acid to help absorb vitamins and minerals such as magnesium. So those are just a few things. Like I said, I could just go on a rant on mag all day long. Like I'm telling y'all like a little bit about it, but that's just a little bit in a nutshell. So, and then zinc is another one I could go on, but the number one thing that pops in my head with zinc is your immune system. So zinc helps inhibit atrophy of your thymus gland, which sits like right above your heart. And it helps produce what's called T cells, which help increase your immune system. So, when you come in contact with a virus or an illness, your body is gonna be able to fight it off easier if you're zinc sufficient, whereas if you are zinc deficient, your immune system isn't going to be as strong. You're not going to be able to fight it off. Same goes hand in hand with wound healing. Many people that have problems with sores and wounds, it's related to a zinc deficiency. If you see that you have ulcers or sores in your mouth, check for zinc deficiency, because that has been shown to be a number one sign of zinc deficiency. So, and then
you said vitamin D.
Vitamin D, so oof.
Which pairs well with magnesium.
Which pairs well with magnesium and zinc. Yeah, because it's good for your immune system and stuff too. And so vitamin D is, I think over half of the people in the world, is the stat that I read, are deficient in vitamin D. So a therapeutic range would be anywhere from 40 to 75-ish. If I had to give you like my therapeutic range, I'd like to be on the upper end of that.
And levels, you're saying when you check that in someone's labs?
When do I check it?
That you're saying that
their
that's
level.
the
That's where that would be a therapeutic range.
Lab results.
So anything lower than 30 is considered abnormal vitamin D levels. So vitamin D is, we get it from the sun, which most people never see the sun. Everybody works inside. It's not like the old days when you're out working in the fields and stuff and you're getting that vitamin D every day. So most people are inside. And then also diet, like cholesterol, eggs, and like that's a big one for vitamin D. Sun, cholesterol, that's where you get your vitamin D from. So you need to be sufficient in vitamin D. for not only your immune system and your mood, but also bones is like really comes to my mind, because I think I read as well that vitamin D increases your calcium absorption by up to like 40%. Like that's huge. So, and you need that for bone health, to help prevent, osteoporosis and, especially our older, population. It's really important for them. What else? Vitamin D. Oh, another thing. I forgot to mention this with magnesium. If you're on a vitamin D supplement, but you are magnesium deficient, you are probably not doing yourself a favor. Magnesium helps activate and transport vitamin D. So if you're not sufficient with magnesium, the likelihood that your vitamin D levels are normal is slim. So that's very important as well. So that's what I mean by they go hand in hand. A lot of these labs are not routinely checked in the office. Like I know personally, like where I've trained and where I'm working, we check our vitamin D annually, but we never check any other labs. And sometimes they don't even check a vitamin D. So sometimes you have to be your own advocate and ask for these things. Because, if you're feeling off for whatever reason, it could just be something as simple and as small as like magnesium, zinc, vitamin D, and that's a quick fix. I personally, with magnesium, I think any twitching of some sort or cramps is like indicative of a magnesium deficiency. I had twitching of my eye constantly, and I'm like, oh my gosh, why is my eye twitching so much? It just bothered me. And then I was like, shoot, let me take some magnesium. I took magnesium for a couple weeks.
You took glycinate.
Right. Mag-glycinate, yes. And it went away. And then we ran out and we didn't get any for a while. And
twitching all over.
Then it started twitching again. Yeah, but like I've had, people tell me they have restless legs or cramps in their legs. I'm like, hey, try to take magnesium. See if it helps. If not, then we can further investigate. But I think you had asked me like what a typical dosage for magnesium for people.
So in general, what would be a pretty good guideline for dosage?
I would say
magnesium glycinate,
300 to 400 milligrams a day for women, and then 400 to 500 for male. This is just like an average healthy person. No like comorbidities, like I said, like kidney disease, stuff like that. And, of course, I'm not prescribing anything. You should totally speak to your doctor or provider before you start taking anything. But there you go. Yeah. There's my top 3. I could keep going, but I'm going to stop.
I like them. So we just want to kind of get this information out and share what we like. That was a lot of insight on those supplements and the benefits of them. I have a hard time picking just 3 supplements. I love all of those. Pretty good for generally anybody.
Also, they're kind of feasible. They're accessible. Yeah. You can get them at any store, and they're pretty feasible. So that I took that into account too when I was choosing my top 3.
Yeah. I'm gonna stick with feasible, accessible, pretty cheap, and like generally safe and beneficial for most people. So my take on this, I'm gonna give my top 3 supplements that these are 3 that like you can get from your diet, but you might want to supplement, but are pretty essential to get in one way or another, which my 3 are going to be protein, which could be like a whey protein, omega-3s, fish oil, and I think my 3rd was magnesium. I have to steal one of yours. I like all your 3,
like number 1.
But big on magnesium. And I say that just because a lot of people don't get enough. Another dietary need that could be a supplement I'd really like to include in that would be like electrolytes. So your minerals, like we talked about, Celtic salt, which has, you want your magnesium and your sodium, like we spoke about earlier, and your potassium. So you should get that from your diet. Having the right amount of salt on your food for you. If you don't have any like bad hypertension or kidney problems, usually like salt is not bad for you. And then protein and omega-3s too. Like I love to get for my diet. We're huge salmon eaters, and just, protein eaters. But there's a great place for a supplement for that if you need that extra, that has not come from your diet. Then you could supplement that. I guess that's 4. I cheated, but magnesium, the whey protein, the electrolytes, minerals, and the fish oil. I'm big on those because, obviously protein is pretty essential, not just for life, but a higher amount is going to be required for building muscle. Typically, like the recommended protein intake for the average American is really low, just because those recommended guidelines are like your minimum just to live, to not be like wasting away. But if you're lifting, you're exercising hard in some capacity, you want to build some muscle, generally around like 1 gram per pound of body weight of protein is great. And a protein supplement like whey, if you don't have any like issues with dairy or anything like that, whey protein is a great way to do that.
And water, what do you recommend? I think what I read.
A supplement?
Well,
I take a water supplement.
you do?
Yeah.
I didn't know that.
It comes right out of the fridge.
Oh my God, you stupid. Isn't it like half of your body weight? So if I weigh 140 pounds, like I should get around like
that's a pretty
80 ounces.
good.
I read that.
It's a pretty good
I don't know if that's
guideline,
what you
unless
recommend.
you're losing more.
I try to get 100 ounces at least a day.
I give most clients a recommendation of, depending on the client, obviously, most of them are, exercising. So around a gallon, shooting for like kind of close to a gallon,
right?
Maybe more than that for some people, and then just like being intuitive, going off of when you're thirsty.
That's why electrolytes
the
are
electrolytes
so
are important to have with that
to
too.
replenish, because between the water and you're just flushing your body out, and then you're working out, you're losing more sodium, electrolytes. So it's very important. I learned the hard way.
And you get low, your body will tell you.
Oh yeah.
And a lot of times too, even if you do check that stuff in like blood work, if you get labs drawn and see your electrolytes, by the time your sodium or potassium is showing up low in your blood, it's already been like extra low in your muscles, or anywhere else. So you could be a little deficient before you even show up as deficient on blood work. It's easier for your body, as long as you're hydrating, it's easier. And again, unless you have some kind of kidney issue or something, in general, easier to get rid of excess electrolytes than like to create electrolytes that you can't make something that you're not putting in, right? If you don't give your body the materials, you don't have it.
Right.
It's easier to get rid of extra, so long as you're healthy and you're hydrating, than to make more that you're not giving yourself.
Same with the vitamins.
So those are my favorite like dietary essentials that you could supplement. I love the fish oil just for inflammation. Research suggests that it's great for brain health and for mood. And for me, I try not to show it on this podcast, but I'm pretty ADD, and fish oil is like really essential for me. It just helped me focus. Your gut, your brain, your joints, everything is gonna feel a little better if you get enough omega-3s in. And it's generally safe to like kind of mega dose. Like I take a lot of fish oil pills a day, and I eat a lot of salmon. And it's usually safe to kind of, a lot of people will supplement it and like won't really get that much from a supplement, but that's one that generally you can take more of. And it's not going to be as harmful as like one of my other favorite supplements, which I'll go into my 3 supplements that are not really going to come from diet so much, that I do always like to supplement. That's going to be, magnesium could fall into either one. I like creatine, which yes, comes from your diet, but not in the amount that you're gonna need to bodybuild. Too much, like way too much creatine's not gonna be a good thing. You usually don't need more than like 5 to 10 grams daily. It's gonna saturate in your body over some time, and then there's a lot of benefits to that, not just for performance and for muscle. It's obviously a source of energy. You make ATP from creatine. That's your energy source, like for heavy lifting. So for strength and for putting on muscle, for holding more water in the muscle cells, creatine's great, but it's also shown to be really beneficial for brain health and energy. One of the things. So that's one. God, there's so many to pick from. I like L-theanine a lot, which is something that's found in green tea, and that helps a lot with mood, focus, and anxiety. It just kind of helps relax you without like feeling drowsy. It's what makes tea kind of relaxing, I guess you could say, and pairs well with my other favorite. So this one is not like a recommendation for everybody.
Oh boy.
But this is one of my favorite supplements for sure, which is gonna be caffeine.
Oh.
And again, not the one we were thinking. That's another podcast. But I like caffeine. A lot of people like caffeine.
I'm addicted
as
to
a
caffeine.
supplement. Obviously, that can also come from your food. You can consider coffee a food. Chocolate has some caffeine. I like it in all kinds of
forms.
form.
Get a lot of. That's my favorite source to
From
get
chocolate.
magnesium from dark chocolate.
I guess I could say chocolate's a favorite supplement too.
Dark chocolate.
But it might not be conducive to your goals. But I really like caffeine. That's for
People
me
like me.
personally. There's a right and wrong amount. Going back to the drains and charges we talked about, a little bit is better for me than none. Sometimes I do too much, and that's not great. And that's also going to deplete electrolytes, especially magnesium.
And
So the
vitamins and
magnesium
minerals.
is great for you if you drink caffeine too. That's also why I like supplements like the L-theanine to balance that out a little bit. So those are my top 3. I gave 6 or 7, but
I'm not
I like them.
shocked.
We could list off a few more, but
Nah, I'll
might
keep
be
it short and
something for
sweet.
another
We're already
podcast.
at an hour.
we did it.
We don't want to bore them too much.
We did a whole hour.
I know.
So
We were like, 30 minutes.
yeah, I think the dogs got tired of the podcast, but we're definitely going to bring them back on. We have some other topics to come in the coming weeks, so we want to talk next more about something Brittany's been doing different for the month. We want to talk a little more in depth from both of our different perspectives about labs and hormones and like supplements, hormone therapies, PEDs, all that kind of stuff.
I know. We're
So,
definitely like moving forward. I think we're going to have to have one like subject and go
Okay.
on that, because I could have really went in depth just on my top 3 vitamins.
Yeah.
That way we can go in depth and not bore people.
I'm just
be all
glad
over
we
the
did
place.
like a full
Oh no,
podcast.
it's our
like,
first one.
50
It's very
minutes.
like,
So
it's our first one. But
if you guys are still listening, that's
Yeah.
awesome. Hope we can, just continue to put these out. We do want to eventually like upgrade some equipment and stuff, get a studio, bring some more guests on, and get better at doing it, obviously. But I really just want to start, and I encourage you guys, if it's anything that you want to do, like just
please
start.
put
if
it in the
if it
comments.
might help somebody, just like put it out there. whether you guys are listening on here or finding something on some short form videos or reels that we get out of this. Just want to help. So any questions, any like suggestions that you guys have, feel free to ask a question that we could talk on the next podcast, or just like reach out to me. We'll put my Instagram and Brittany's info on there if you want to send us a message. I think we're done. We did a whole 50 minutes.
Yeah.
Pretty awesome.
Reese,
Thank you guys for watching.
You want to meet everybody? Nobody's seen you.
Episode 1 of the Stancil Strength Podcast. We're going to introduce you guys to...
This is our Reese girl,
They
Remy.
didn't say much, honestly. But you were a good guest.
Remy was in our lap the entire
And
time.
this is Remy.
She's homeless right now. She just got shaved.
We shouldn't have shown her, honestly.
Well, that's okay. Her hair will grow back in 6 months.
But, all right. Thank you guys for watching. Stay tuned for the next one. Leave a comment, drop a question if you have any, and we'll see you soon.